Alright, love. Here we go. Tenormin, or atenolol, class, anti-anginal, antihypertensive, beta blocker. Usual action is a beta-1 selective or cardioselective beta adrenergic receptor blocking agent without membrane stabilizing or intrinsic sympathomimetic partial agonist activities. This preferential effect is not absolute, however, and at higher doses, Tenormin, or atenolol tablets, inhibits beta-2 angioreceptors, chiefly located in the bronchial or vascular musculature. Side effects: dizziness, lightheadedness, diarrhea, and nausea. Adverse effects: bradycardia, hypotension, CHF, or congestive heart failure. Nursing implications: monitor blood pressure, check for rales or crackles in chest, and heart rate. Next, heparin, class, anticoagulant. Usual action: acts at multiple sites in coagulation process, binds to antithrombin 3, catalyzing inactivation of thrombin and other clotting factors. Adverse effects: hemorrhage, thrombocytopenia, severe, HIT or HIT, hypersensitivity. Nursing implications: monitor INR, APTT, then Q4, PLT, which I believe was platelets, at baseline, then periodically, HCT, ACT or ACT if PCI, and anti-XA or whatever that is, levels in PEDs. Antidote is the protamine sulfate, and level for APTT is 25 to 32. Subcutaneous sites: anterior, lateral, upper arms, or anterior thigh. Make sure you check with your professor, like you said you would for that one. Lower abdominal wall, 2 inches away for the umbilicus for slow absorption. Scapular of back, upper ventral or dorsogluteal areas, the back of the butt cheeks. Okay. Trade generic name: Lasix and furosemide. Classification or category is a loop diuretic. Mechanism of action: inhibits reabsorption of sodium and chloride at proximal and distal tubule in the loop of Henle. Desired effect: treats fluid retention, edema, and high blood pressure. Side effects: hypokalemia, hypomagnesemia, hyperuricemia, hypocalcemia, hyponatremia, nausea, polyuria, renal failure, thrombocytopenia, leukopenia, neutropenia, anemia, and rash. I'll repeat those. Side effects: hypokalemia, hypomagnesemia, hyperuricemia, hypocalcemia, hyponatremia, nausea, polyuria, renal failure, thrombocytopenia, leukopenia, neutropenia, anemia, and rash. Okay. Nursing implications: weight, blood pressure, rashes, and temperature change. Monitor electrolyte potassium, normal range for potassium 3.5 to 5.0. Alright, phenytoin or Dilantin. Class, anticonvulsant, antidisrhythmic. Action, inhibits spread of seizure activity in motor cortex by altering ion transport, increases AV conduction. Side effects, nausea, vomiting, drowsiness, dizziness, depression. The ones you want to remember are suicidal tendencies, ventricular fibrillation, nephritis, hepatitis. Again, suicidal tendencies, ventricular fibrillation, nephritis, hepatitis. Okay? Nursing implication. Assess Dilantin level, mental status, mood, affect, memory, long and short, suicidal thoughts, and check for rate and depth, skin disorders that could lead to Stevens-Johnson syndrome, and hypersensitivity. Therapeutic level 10 to 20 mcg per milliliter. Toxic level 30 to 50 mcg per milliliter. Warfarin or Coumadin or Coumadin. Class, anticoagulant. Action, interferes with vitamin K dependent clotting factors 2, 7, 9, 10 as well as protein C and S. Again, interferes with vitamin K dependent clotting factors. Example 2, 7, 9, 10 as well as protein C and S. Side effects, hemorrhage, dermatitis, alopecia, and nausea, vomiting and or diarrhea. Nursing implication. Monitor blood clotting. INR therapeutic level 2 to 3. Assess for bruising and or bleeding. Teach patient to avoid injury and check patient drug regimen as there are many possible drug interactions. And remember, vitamin K is the antidote. Keep on hand. Next, glucagon. Class, insulin antagonist. Action, induces liver glycogen breakdown and glucose release. Relaxes GI smooth muscle, used as antidote for hypoglycemia. Generic name, dexamethasone. Trade name, Decadron. Classification, glucocorticoid, hormone, anti-inflammatory. Action, decreases inflammation by reducing capillary permeability, increases serum, VITA, vitamin A or Vit A, whatever that is. Uses, short-term treatment of various inflammatory allergic disorders. Adverse effects, acne, bradycardia, depression, hyperglycemia. Nursing implications, taper dose to high doses or long-term use. Monitor serum glucose, and for pregnant mothers, educate that medication is excreted in breast milk during lactation. Next, we have digoxin. Class, cardiac glycoside inotropic. Actions, inhibits Na+/Ka+ AT base pump, making more Ca++ available for contractile proteins, resulting in an increased force of contraction, plus positive inotropic effect, and decreasing the heart rate, negative conotropic effect. Adverse effects, bradycardia, hypotension, toxicity, blurred vision, nausea, vomiting. Nursing implications, assess apical pulse for 1 minute. If heart rate is below 60, minus hold, notify medical doctor. If K positive, low, hold. may cause toxicity. And the antidote is digoxin immune FAB or Digibind. Generic carvedilol, trade Corig. Class alpha and beta adrenergic blocker, antihypertensive. Action competitively blocks alpha beta and beta 2 adrenergic receptors and has some sympathomimetic activity at beta 2 receptors. Indications for patients with HTN, MI, and dysrhythmias. Contraindications. Patient with low blood pressure, heart failure, bradycardia, bronchospasms, and renal disease should not use this drug. DM patient. Caution because it might mask the signs of hyperglycemia. Adverse effects: heart failure, hepatic failure. Nursing implications: check patient blood pressure. If it is too low, hold medication and call doctor. Assess for orthostatic hypertension, respiratory distress, and bradycardia. Teach patient to take with food. Do not stop taking unless instructed. Do not take OTC cold medications. Report changes in stool color or urine and edema in low extremities. Procardia or nifedipine, one of those. Class: antihypertensive, calcium channel blocker. Action: increases relaxation and dilation of smooth muscle in coronary arteries and arterioles. Indications: treat patients with hypertension and patients with uncontrolled angina. Contraindications: should not be given to patients with low blood pressure, low apical heart rate, and those who have sensitivity to procardia. Adverse effects: anaphylaxis and hypersensitivity. Side effects include dizziness, anxiety, low blood pressure, bradycardia, headache, and lightheadedness. Nursing implications: check vital signs for low blood pressure or bradycardia and hold if the heart rate is less than 50 beats per minute. Teach patients not to take any OTC medications that include calcium supplements or antacids. Also consult with physician about OTC medications reactions with procardia. Do not drive or operate heavy machinery if patient is experiencing any adverse effects, and speak to physician about signs and symptoms of procardia reactions. Note sub-Q injection sites: bilateral outer arms, thighs, abdomen, 2 inches away from the belly button, and umbilicus, above the hips and the back, and bilateral scapulus. PEG or PEG tube med administration. You're going to lift the head of bed to semi-Fowler's 45 degree. Check patency by aspirating/checking residuals. Crush pills. Flush with 20 milliliters of water. INR. The International Normalizing Ratio is used to monitor oral anticoagulant therapy, or Coumadin, because the strength of available thromboplastin used in the PT lab test varies. The higher the INR is, the more easily the patient will bleed. If the INR is too low, it is not therapeutically benefiting the patient, They are not anticoagulated. Normal INR is 0.5 to 2.5. Therapeutic INR is 2 to 3. Name, protamine sulfate. Classification, heparin antagonist. Action, binds heparin, making it ineffective. Indications/uses, heparin, hemorrhage, LMWH, toxicity. Common routes, 4. Adverse effects, circulatory collapse, pulmonary edema, severe respiratory distress, anaphylaxis, angioedema. Nursing implications, assess hypersensitivity, dermatitis, skin rash, urticarial cough, wheezing, allergy to fish, BLD studies, HCT, platelets, occult, BLD stool, Q3MO. Sorry, I don't know what those mean. APTT, ACT, 15-minute after dose, then again in several hours. The V/S after 30 minutes, then 3 hours after dose. PT education. Do not take if allergic to fish. Generic vitamin K1, phytonadione. Trade, mephaton. Classification, vitamin, prothrombinogenic, binogenic. Antidote or hemorrhagic. Action, vitamin K, a fat soluble vitamin, essential for hepatic production of 4 blood coagulation factors, including prothrombin, required for normal blood clotting. Indications, used to treat vitamin K deficiency and to treat bleeding disorders or blood clotting problems. Used to correct excess anticoagulation after the use of warfarin or Coumadin to increase INR, the antidote. Common routes, SC or oral. Adverse effects, anaphylaxis, diaphoresis, hypotension, cardiac and or respiratory arrest. Nursing considerations, drug interactions with antibiotics, blood thinners, salicylates, such as aspirin, and monitor PT and INR. Okay, so this is a little bit over 18 minutes. Just read through everything for the notes. One thing I couldn't really go over is the diagrams for the injections, but I kind of went through that. Best thing you can do is just rewind this, keep playing it over again, and that's pretty much it. Just know I'll be praying for you. I love you very much, and don't stress about this, and just do your best, babe. And just remember that I am thinking about you, and I miss you, and call me when you're done, okay? You have a good day, babe. I love you. Bye.